All right, well, let's get started. Just give me 1 second. Get this sorted out. All right, well, welcome everyone to the BI reporting and business use case track of DataCon LA 2020. My name is Kalyan Todorov. I'll be your host for this session, and I'm also joined by Mark Waddell, who will also be a co-host and help with moderation. The title of today's talk is Visualizing COVID-19 Data, presented by Alex Pudlin. Before I introduce him, just a little note here. So we will have some time for Q&A after the talk. So please use the Whova app to ask your questions. There is a session Q&A question. I actually see that some people already use that, which is great. And you could also use that for chat during the meeting. And Alex, I guess after you're done presenting, I will just read some of those questions out to you, kind of in the order they were asked, and then we'll take it from there. And with that, let me introduce Alex. Alex Pudlin is the director of Mayor Eric Garcetti's innovation team, which is a team of data scientists, designers, and researchers seeking to bring change to local government, remedy inequities for LA residents, and improve service delivery. Since 2015, the team has worked on topics such as reducing residential displacement in gentrifying neighborhoods, creating new employment pathways, and most recently helping lead the city's COVID-19 response, which will be the focus of his talk today. And with that, Alex, the virtual floor is yours. Take it away.
Thank you so much. Very excited to be here today. Hope everyone's having a great conference so far. So today's talk, as was mentioned, I'm Alex Pudlin. I'm the director of the innovation team. And today we'll be talking a bit about the city of Los Angeles's COVID-19 response, and particularly the early stages of trying to understand what the data was telling us, where the data was, and so forth. I believe this story, although it's focused on COVID-19, should have relevance to many of you out there on your own data projects, anything involving business intelligence, data narrative, data visualization. I think a lot of the lessons that we'll go through today and the challenges that we had to overcome in the city of Los Angeles will have relevance to broader topics as well. So to start out, I'm Alex Pudlin. I'm the director of Mayor Eric Garcetti's innovation team in Los Angeles. And the innovation team, prior to when COVID started, in terms of kind of what our focus was as a team, we were a group within the mayor's office acting sort of as an in-house consultancy. So we would work on projects for generally about a year, partnering with different departments throughout the city to try to address some of the largest civic challenges of the day. And the team started in 2015 as part of Bloomberg Philanthropies iTeam network, which now includes cities across the country as well as the world. And then we were adopted into the city budget in 2018. And we're a multidisciplinary team. So data, which will be a big focus of today, is one of the key elements of how we try to work on civic challenges and problems. But we also, just as important, are our project management skill sets and very much so design, particularly human-centered design. So trying to understand problems, not only in terms of quantitative data, but qualitative data as well, and how the two interact. So prior to COVID, so prior to March 12th, which was the mayor's office official first response day, our team operated more like this picture you see on the left side. Now, of course, we never had this many people on the team, never hundreds of people, but the idea is, and our team right now is about 10 people, that we would have time to really look into a problem in a very methodical, well-paced sort of way, building in time to reevaluate initial assumptions that we had, prototype various solutions, and work on deadlines, of course, to get projects off the ground, but the pace allowed us to really sit back and reflect. On the right side, you have a picture of someone fixing up the plane while the plane is flying. And once COVID-19 started and our pandemic response started, our team was redeployed. Our skill sets were redeployed to focus on delivering kind of results and understanding on a daily basis as the pandemic itself was not super well understood, to say the least. And I will go in a minute, what are some of the other kind of challenges in those early days, as we knew that it was important to collect various data to tell us what to expect, to gear us towards what services would be helpful to deliver our residents. All of that was sort of learned as we were actually delivering. So I'm going to give a little more background as well. I'm not sure how many people are sort of familiar with the setup of Los Angeles, the city of Los Angeles, because the setup of our city in relation to the county underscores a lot of the challenges early on, and still to this day, in terms of compiling all of the necessary data. So the city of Los Angeles does not actually have its own public health department. We're one city amongst 88 in the county, and most of the cities are in the same boat, do not have their own public health department, whereas the county of Los Angeles oversees all public health functions through two different public health departments that they have, the Department of Public Health and the Department of Health Services. The Department of Public Health formed from the Department of Health Services in 2007 to take on more of a research and enforcement role. So early on, as we're trying to get a sense of, how many people have this particular disease? How are our hospitals looking in terms of capacity? How much personal protective equipment do we have? A lot of those questions were not data that were in our own control as a city. But complicating things even more is that not all of the data were in control of the county either. Two of the largest cities in the county, Long Beach and Pasadena, had their own health departments. So on day one, even trying to answer the question of how many cases, we had to work with the county to get those answers. And the county, in turn, had to work with two other public health departments to ingest that data. So it gives a little sense, and I'll go into a little more detail here about how that sort of plays out. But in the early days, the need was simple, difficult to deliver, but I think simple to articulate. And that's really how, what's going on? What is this disease? Where is it spreading? How quickly is it spreading? How sick are people getting? And making sure that we have good enough data to be able to tell a narrative and brief the mayor on a daily basis, often more than daily basis, in terms to help sort of steer our city's response, develop assistance programs that are actually going to help the people who need them the most. And of course, share all of the same key information with the general public. So the challenges to do that, and I alluded to these in the previous slides with the jurisdictional setup, is just the difficulty that the city of Los Angeles does not control a lot of its own data. Now, there were exceptions to that. Early on, we established our own testing program with our fire departments. All of that data were data that we were collecting, as well as all of the programs that we set up, our senior meals delivery program, other forms of assistance. That was under our control, but really anything related to public health was not at all within our control. And the different sources from which that data came in a variety of different ways. So if we're lucky, maybe we could connect to an API and have an automatic connection. But oftentimes the best that we could hope for would be a CSV. In a lot of cases, a PDF was really all that we could get, and manual data entry was necessary. The other challenge in terms of delivering something on a daily basis is that all of these different data sources arrive at at many different times. They all also have different data lags built in. So sometimes when it comes to hospital capacity, we're not going to know the information. The most recent information would be the prior day. And added to that is just the complexity that even in a perfect world, when all of the various data around COVID come in, there's lagging indicators. So someone who is diagnosed today is generally not going to be hospitalized immediately. That often will take a few days. If someone gets really sick, the mortality trends could take multiple weeks longer. So trying to get all this together and tell kind of a coherent story, and understanding not only what are the indicators we want to look at, what are the main metrics that that give us a sense of really how we're doing from a public health perspective, as well as from an assistance perspective and a behavioral perspective. So overcoming challenges, I think the approaches that I'm going to go through here, again, are ones that prior to COVID-19, we certainly employed in all of the work that we did around in the past around neighborhood change and reducing displacement and employment. So I think that this is relevant for sort of topic agnostic. So one is really around communication. Even in the best case scenario, there will probably be data that you will need that you do not control. And so early on, as we connected with our counterparts in the Department of Public Health, connected with other departments within the city, it was important to listen and understand what exactly they're collecting, what are the questions that need to be answered. Now, a lot of times this idea of building the plane while flying it is something that really everybody is doing. So what we got back on day 1, day 2, day 3 was not perfect. And so it's important to be patient and persistent and persevere and know that over time a lot of the data will get better. And with that, you need to have flexibility so that early on, it was about building with whatever we could find, but months in, some of those data sources stabilized. Some of what was a PDF was now able to be accessed directly through a live HTML table or something like that. And so being able to have the flexibility to re-engage and re-engineer the work and be critical in terms of updating and not saying, well, we built it a certain way. If you can improve it, you should, and we did. And lastly, that there's just different trajectories to all of your different data sources. Some of these data sources that were PDF on day 1 are now PDF 8 months later as well. And so treating each on its own and knowing that maybe you can have a script that will automate these 8 data sets, but there's going to be others, and just being patient and trying to make all the pieces fit together as best as possible. So next, I'm going to go into 3 particular challenges that we had to overcome, and they're challenges of different nature. So the first one is really, what content should we share every day? So knowing that we needed to brief the mayor every day, and our team reported into our chief innovation officer, who every day, sometimes multiple times a day, had data briefings with the mayor. So it was important to make sure that we were on the same page, our team with the chief innovation officer, and then of course with the mayor. And so a lot of the content of what went into the report, or at least when we kind of planned it out, we knew that there were priorities that the mayor had. The mayor every day was talking to the director of public health, Dr. Ferrer, and in those early days, even with all the uncertainty, it was clear that we wanted to know how many cases we had each day, how many people ultimately were not surviving COVID, how many people were hospitalized, what was the capacity, how often were we testing, especially early on, what was our capacity of the testing versus the demand. And so all of that was determined in conversations between the chief innovation officer and the mayor and Dr. Ferrer. And then over time, as we actually, and I'll show you sort of the end results of all this work, certainly in a little bit. As we presented to the public, there were people on Twitter or Facebook that had opinions and thoughts of other things that might be useful to track. And so that was certainly important, as well as were the different departments within the city. As they were standing up programs, they wanted to make sure that the public knew about those programs and how they were unfolding. And lastly, in terms of kind of topics, and I alluded to this a minute ago, was the question of tracking behavior. So early on, the city decided to go into a lockdown of sorts, which we named Safer at Home. And in that, there were a lot of businesses that were not allowed to operate. I'm sure you all have experienced it, and to this day, there's quite a few restrictions. But knowing that there are certain businesses that were closed, how often are people still traveling to those businesses, and finding seeing where is there a theme to kind of what sort of businesses are non-compliant, and being able to address potential non-compliance and a hotspot that could result from that, was really important to us too. And then lastly, was sort of more of the macro metrics. In terms of knowing what our trends are, early on, it was important, and I mean, still to this day, saying day over day, how many new cases did we have? How many new hospitalizations did we have? But the problem is we learned once a few weeks in and the data started being reported more consistently, that there are certain days of the week, for instance, Mondays, where the cases are always going to be lower because of a reporting lag. Also early on, something like the percent increase in total cases. Early when the numbers are low, seeing that, wow, total cases went up 7% today is really informative. But once you reach a certain threshold, where we are today, it's more in the 1% range and just doesn't become as useful to track. Which leads to looking more at averages, 7-day averages, 14-day averages, and so forth. Early on, another thing that was really important was looking at the doubling rate, and that's how many days does it take for our case total to double. Again, we're now, unfortunately, almost at 300,000 cases. The amount of time it'll take for that to double is way less relevant to us today than early on when we had 5 cases. And lastly is the basic reproduction number. And this is a metric that has only grown in importance. And that's really if one person is infected with COVID-19, how many people are they expected to spread it to? And that is really used as a way to track infection. I'll just skip back. Second challenge is there's certain indicators that are really important that can be measured in a lot of different ways. And so there's the need to say, today, this is how many cases were reported. But unfortunately, a lot of the systems that are used to track the data are quite old, and connectivity issues are just this past week, there were major connectivity issues to the electronic lab records systems, which led to delays in terms of no cases being reported for a few, or undervout counts, and then that caught up, and then you had an overcount. And so what we see here on the left side, this graph shows 3 different averages of new cases. And the right graph zooms in on this peak here in the middle of July. And what you can see, I think focusing on the right side probably makes the most sense. Each of these individual dots are new cases. So if you just look at those, you could see a trend in there, but you could see that even in a short period of time, there's major variation. But even if we look at averages, we learned early on, we basically look to say, there's this many total cases today, and there were this many total cases yesterday. The new cases is the difference between the two. Unfortunately, we quickly learned that as new cases come in, a lot of old cases actually get removed because they're discovered to be duplicate cases or false positives, or they're not actually within Los Angeles County boundaries. So what we see here on the right side, the gold graph, the gold trend line, is if you do a 7-day average based on the day over day math, whereas the blue line is the actual cases reported. So there's not a huge difference. But again, what's reported is based on as soon as the information comes in. That doesn't necessarily mean that a case reported today, that's when the infection happened. So what the county does is, for all of the cases that are reported, they assign an episode date. And an episode date is really the earliest of several different dates. So it could be when symptoms first were reported. It could be the first positive test result. It's the earliest of those days. And what you see there, which is our pink graph, is that it shows that the various peaks are actually earlier than when they're reported. That makes sense. In some cases, quite a few days earlier. And so the challenge using the episode date is that if I want to tell and put in our briefing, this is how many new cases we had, and look at the episode date yesterday or the day before, it's going to be very incomplete because many of the cases, the episode date isn't even known. And so our approach was really to kind of, and in our next challenge, this is very much the case too, is showing all of the different measures and contextualizing them, making very clear to caveat, what does this measure show? What can we learn from it? And where are their limitations? And making sure that it's curated in such a way that we're showing the information, not confusing people with the information, but also pointing out that there's very real differences in how what seemingly can be the same exact indicator can actually be looked at different ways. That's even more apparent with this particular indicator, is that one measure could actually have several different numbers based on whether you're looking at, say, within LA City boundaries versus Los Angeles County, whether you're looking at the overall rates versus what's been happening over the past 7 days. So here we see 7 different ways of looking at positivity rates. A few of these, so our orange line at the top, for instance, and our pink line in the middle are cumulative. And that's just the overall rate. And so, yes, it's nice, it's going down, but it's not that informative in terms of kind of what's going on in the moment. It's more of just kind of an overall picture. The other thing that's difficult to sort of sort out, and the complexity is that you have, when you say positivity rates and then have 7 different numbers, it's bound to confuse people. And so again, that's where the approach of reporting all of the different measures, but making it very clear what you're reporting is important. And so what we see here, the other difference is what are we even measuring with positivity rates? some of these measures, such as our gold line, that's the 7-day rate of the percentage of people who tested positive. So if one person has multiple tests, that person is only counted once. Whereas the blue line below it, at the bottom, is the specimens tested. And so these are the actual tests that are conducted. So someone who has to test multiple days in a row to prove that they're now no longer positive, that those results get counted every time. And then lastly, and this is probably the most important of all these measures, are our dots here. And what these dots represent are how the state measures Los Angeles County's positivity rate. Once they remove cases that were at correctional facilities, and there's other adjustments. So it's all basically to illustrate that having a single number, and you'll see this single number positivity rate reported all over the place, all over the country, comparing different countries. And when you look at the fine print, there's quite a few differences throughout. So briefly, before concluding, I do want to share, as we've been working through these challenges over the months, what the end result was. And so first up is the briefing that I alluded to. So here are a few slides from the briefing. Each day it ranges somewhere between 45 and 100 slides. So on Wednesdays, for instance, we report about crime rate and homicide rate and N95 mask supply and other areas that we may not report about every single day, which is focused more on the public health measures, and some of our programs, our senior meals program and things of that nature. And so to date, we've actually now produced over 170 of these. They're all available to download on the mayor's COVID page, which I'll share a link in a moment. The next application is something a little more real time, and this is a recovery dashboard that the innovation team we developed along with the data team in the mayor's office, and with assistance from Slalom. And this gives a more real-time look, as well as comparing what's going on in the city of Los Angeles versus the county. Our daily briefings do a bit of both as well, but in general are more at the county level. So this is a way to see what's going on at the city level, and have a more interactive, real-time way of displaying the information. Third up is as we've gotten to the point where we've centralized all of the various data, we have data that we may not report on every day in our briefings, but it may have other uses for if the mayor's going to go on a national interview, and there may be other information that's useful. So as case in point, this looks at Los Angeles City as a percentage of the cases in Los Angeles County and the state. So we could see the city's share has gone down over time, but is still overrepresented. And lastly, and this is a bit of a preview for some of our upcoming applications with this work, is we've developed a new map that looks at the data on an even more granular level than city. So we look at our neighborhood boundaries to see where case rates are increasing in relation to other areas of the city. And this has a lot of different applications. Currently, the main one is we're using these maps for our testing teams who do between 12 and 15,000 COVID tests a day. We have 9 static locations throughout the city, but then we also have mobile testing sites where each day they're in different locations. So having this information in a more dynamic sense, where it updates every week to show the most recent 2-week rate, is certainly helpful for testing, but we're working to make it have more applications and have a public release, because the information, just in general, knowing where our hotspots are, has a lot of applications, and we look forward to sharing those with you soon. So thank you. I have my email here as well as my Twitter. Please do reach out. We'll have some time for questions, but if you don't have a chance to ask, please do reach out. And as well, encourage you to check out the coronavirus website. So the data portion of it is one small portion of a lot of different resources that are available on the page, including booking if you want to get a COVID test. There's links to register there, and a lot of other helpful information. And there's the quick link to the data page, which includes both the live recovery dashboard and the briefings. And then there's our innovation team website, if you want to check out some of the other work that we've done over the years. With that, ready to take some questions. Thank you so much for hosting me and for listening.
All right. Well, thank you, Alex. This was actually pretty interesting. And yes, we do have some questions, so let me read those out. Actually, the first one that was asked, what are some cool visualization anyone has seen this past year? It applies to anyone, but also to you, Alex. I would ask you to answer this in writing later, because I imagine it's mostly links. So I will move on to the next question, which is how is data interpretability and citizen science factored into developing visualizations for COVID data?
That's a very good question, and I think it speaks to a lot of the challenges that I went through earlier, but the difficulty, I think, is trying to kind of learn what the information is saying, as really everyone learning at the same time. I mean, we're focused on a disease, sure, and there's other diseases and metrics associated with pandemics that are that we could show, but so much of it is new, and so much of the terminology and what actually matters changes on a daily basis. So I think our approach has been to try to not dumb anything down, try to reveal as much information that we feel like we have a really good handle on, not putting out information that's sort of a mystery to us, and always just making sure that we're checking in with what people are saying on Twitter, what people are calling into our COVID hotline and telling us, and making sure that we're reflecting and responding to any potential confusion, because at the end of the day, it is and remains an incredibly confusing topic. And so our approach has really been to be transparent, and if we present something and the next day realize that way of presenting it doesn't necessarily make sense, we'll amend that and explain why we're now switching the visualization, for instance, to show information this way versus how we used to show it.
Makes sense. Thank you. Another question is, can you discuss a little bit about the technologies you use to create these visualizations?
Yes. So we use quite a few different tools. So many of the visualizations are in Tableau. So Tableau has been helpful in that as we pull data from a lot of different places, it gets centralized into one repository that Tableau can directly tie into. But we also have some other visualizations that are more suited for Python. So some of in addition to showing kind of what's going on in Los Angeles, we like to show what's going on in the country, in different counties throughout the country, and some of those visualizations are just better suited towards pulling directly from an API. And then we have other maps that we'll do in ArcGIS. And then also there's some visualizations. Again, the team that creates these every day are not only data scientists and analysts, but also designers. So we have some visualizations that are done in Illustrator as well.
All right. Thank you for that answer. I see another question. Actually several. New one just came in. Can you talk a little bit about kind of the path that you took into the innovation area and then into the city's innovation office?
Oh, sure. Well, I don't believe my path is necessarily the most common, but I find in the world of data that few paths are. So I initially moved out to LA to pursue screenwriting and got very disillusioned with that world, and then went into urban planning, and through that worked after getting a master's in urban planning for Xerox, working in parking management, specifically on the Express Park project, which was a demand-based parking project. And through that, I just started getting more and more interested in data and using data in a variety of different ways, multidisciplinary ways. I think that's kind of what drove me to this team in the first place. And I have actually been on the team since we started in 2015. And really what drew me to the team was knowing that data is kind of one piece of the puzzle, that it could get you a lot of places, but there's a lot of other disciplines out there that can augment and supplement it. And that's what led me to go to this particular office, and I've stayed ever since, because it's just been great to and very challenging and rewarding to try to look at problems that in many cases people say are unsolvable, and try to solve them, and use a variety of tools like data and design to do so. It's thrilling work, and I encourage others to look for similar work.
Thank you. That's actually is a pretty interesting and atypical path into the world of data. I have another question. Do you have work on tracking data such as from self-reported travel and contact history, and then inferring transmission routes and reporting those in visualizing those?
Mm-hmm. That's a really good question. So we are working closely with the county now on some of their contact tracing efforts. So they have wide contact tracing efforts, and they get a lot of that data, and through that data are able to see, is our text messages kind of our most our useful way of getting to people. Where does sort of the line of communication dry up? And so we're just now starting to look into that in particular. We also, as a city, along with the county, have a partnership with SafePass. It's an app that allows you to each day check in, just say what your symptoms are, and it says whether you've passed people who've reported symptoms that are consistent with COVID-19. And so we're starting to look at some of that data as well. So both of those pieces are in the works, but not quite there yet.
Gotcha. Thank you. I will have time for one more, even though there's two more outstanding here. So I will ask you to take a look at that later after the session is over. But this one is, what are some metrics factored into the county or city's COVID tier level?
So the tier level, and I believe you're referring to the state tier level. So they look at a few different things. Right now, it's sort of for four metrics. So one thing we're measured on is the case rate, and that case rate is there's a delay on the case rate, so it's about a 10-day delay, and it's a case rate over a 7-day period. And that case rate is then adjusted based on how much testing was done in the county. So if you're a county in California that tested a lot more than other counties, you'll have a more favorable adjustment. And then for the case metric, you're evaluated based on that adjusted one. So right now we're in a purple tier, which means that our adjusted rate is over 7 cases per capita, and we have to be below 7 for 2 consecutive weeks to move to the next tier. The other that they look at is a positivity rate based on tests conducted. And the third one, which is a new measure, is also looking at testing, but it's an equity measure to ensure that the most vulnerable neighborhoods in a county, that their testing rates are consistent with the overall testing rates, so that you don't have a situation where the county has a qualifying rate, but you've got segments of the population who are testing much higher, which is something certainly to avoid.
All right. Well, thank you for this answer, and I mean, thank you again for your session and for sharing your insights and your knowledge, and also thanks to everyone in attendance. Yeah, this is all the time we have for this right now. Again, go back. Feel free to go back to Whova. If there's any more questions, there's also a chat. Feel free to chat. Share your favorite visualizations that you've seen. I think I'll share one that I liked. And that's about it. The networking session is starting in about 4 minutes. Feel free to attend that. There'll actually be some prizes, I hear, so it's probably a good idea. Other than that, again, thanks, Alex, and thanks everyone.
Thank you.
See you later.
Thanks so much. Bye-bye.
Bye, everyone.